My name is Lorien Helm, and today I will be talking to you about the right to die with dignity. In 2002, 90-year-old Louise Hall was diagnosed with terminal cancer. Unfortunately, while she underwent radiation therapy, she found that it was too painful to continue, and that even with medication, her pain could not be controlled. Her daughter, a retired college professor and now advocate for death with dignity, tells us that it was clear that her mother was ready to die. Because they lived in Oregon, a state where physician-assisted dying is legal, she was able to ask her physician for a lethal dose of medication to be taken whenever she was ready. After saying goodbye, Louise Hall died peacefully, surrounded by her family, on September 5th, 2002. By passing legislation, physician-assisted dying would allow terminally ill patients the right to determine when they want to die on their own terms. As the daughter of two primary care physicians, I have heard of issues and concerns my parents' patients face. Living in North Carolina and in many states across America, we currently do not have the right to physician-assisted death. Today, I am going to be discussing the history and specifics of physician-assisted dying, how this can positively impact terminally ill people's final days, and why this legal right should be important to you. It's important to understand that physician-assisted dying is not the same as suicide. Physician-assisted dying, also called death with dignity, is a way for terminally ill people to accelerate their death in order to avoid the pain or suffering that their final days may bring. According to an article by the Oncology Nursing Society written in 2016, in order to qualify for death with dignity, you must be a resident in a state where this is legal, you must be 18 years or older, you must be mentally sound enough to make healthcare decisions, and you must be diagnosed with a terminal illness with fewer than a 6-month lifespan. If these qualifications are met, then there are certain requirements you have to go while undergoing this with your physician. There are specific steps that a physician and a patient must address in order for this medication to be prescribed. These steps ensure that this decision is not taken lightly, and good patient care is always upheld. Historically, physician-assisted dying has been used throughout the Appalachian Mountains. According to family practice physician Dr. Kit Helm, in rural medicine, physician-assisted suicide happened unspoken of in the past. However, it was not unheard of for a physician to leave a bottle of morphine next to the bed of a dying person, or to tell a family that they can crush these pills up and put it in their pudding, and this would help to ease their transition. He tells me that he has personally been asked by patients before to write them lethal doses of prescriptions for either themselves or their loved ones. However, in North Carolina, this practice is not currently legal, but he says that passing legislation that would make this legal would allow you to not only set up a support system for the patient, but for their families and for the physicians themselves. It is important to understand that physician-assisted death is only a small part of the bigger picture. The option of another way out can have a positive impact on a terminally ill person's final days. Some patients may even obtain the medication, but never use it. According to an article called Why I Hesitated, an act relative to death with dignity, and then voted for it, by Dr. Margaret M. Gillette, the comfort of having this choice available gives them a sense of control over their own life and gives them some more peace about dying. Those who request physician-assisted death are often scared of loss of their own dignity, for the diminished ability to engage in enjoyable activities, and their lost autonomy. There is only one limiting step. It is currently only legal in 4 states, those shown in blue. This legal right should be available for all patients across the United States. Don Monroe suffered from pain in his jaw, head, and difficulty swallowing for 2 years. His symptoms went undiagnosed, and he suffered from the pain involved. His wife, Robin Toole, talks about his final days as unrelenting pain and suffering. Don wrote his wife, Robin, a note telling her that he had never experienced such pain and fear as he was in these last days of his life. He was diagnosed finally with a rare form of throat cancer, and after unsuccessful intubation, was sent home. His wife tells us that because there was no way to receive physician-assisted death in Arizona, her husband, Don Monroe, shot himself later that night. Now, this case shows us both a failure in pain management by the physicians involved and why physician-assisted death should be legal. Research done by the American Psychological Association shows that most people really just want to have control over their own death. While this is brought up by many, the question of allowing terminal patients who exhibit moderate depression, Rosefield, one of the researchers involved, brings up the point of how cheerful should you be when you have a terminal illness? Now, Dr. Kit Helm addressed this question of the effect that this could have on physicians. He stated that he feels as though modern medicine does not prepare healthcare workers enough for death. He says that this kind of work isn't for everyone. As a healthcare worker, you need to understand that sometimes making people comfortable is the best thing that you can do for them. Now, these points and many others help to not only give people these rights, but give them that sense of control. Physician-assisted dying is not suicide, but an option for terminally ill patients who want to choose when, where, and how they will die. This choice allows patients to feel more in control over their own death. This option should be legal in the entire United States in order to allow patients to have all of the available final options. Thank you.